There are a number of techniques coming out now that, for example, use energy and micro trauma to improve the quality of the skin, to tighten the skin. Now, the two types of treatment that we can use include microneedling. Now, it's clear that if you have minor injuries to the skin that aren't sufficient to cause a scar, these injuries do actually cause inflammation. The inflammation causes production of collagen, and collagen is good for skin health, for skin quality. So classically, there's something called the Derma roller. There's a little bit like the rolling pins that ladies used to use in their hair, but instead of the plastic pins, it's little needles. And lots of tiny little pricks were made into the skin that cause inflammation, produce collagen. Things have moved on, so we use something called the skin pen, which is the only device for microneedling that is FDA approved, as far as I'm aware. And it's the only one where there's an absolute guarantee that you can't contaminate from patient to patient. And it works. Done with a local anesthetic cream, you need 2, 3, 4 treatments. We use it for acne scars and to improve the texture of the skin. Beyond that is something called the Morpheus 8. Now, this was made quite famous because of Judy Murray, Andy Murray's mother, who had this treatment. Now, the Morpheus 8 also uses microneedling, but with the added energy of radio frequency. Radio frequency heats the skin. Again, it's been clearly shown that if you heat the skin to a certain temperature, but not beyond, you'll cause inflammation, production of collagen, and remodeling. So with the Morpheus 8, you have not only microneedling, but also radio frequency. And the Morpheus 8 is usually used as a set of 3 treatments, a month, 2 months, 3 months apart. It's uncomfortable, therefore we have to use local anesthetic cream or injections so that you tolerate the treatment, but it is proven to work. Beyond that is something where you use energy to heat the tissues more profoundly. There are different ways to do that. People have used ultrasonic energy, laser energy, and I have chosen, for various reasons, radio frequency. For example, in the face and the neck, if you heat the tissues to 70 degrees, 60 degrees, 70 degrees Celsius, you will cause an inflammation and remodeling. That process takes 3 to 6 to 9 months, and therefore a tightening is evidence-based, it's proven to work. It doesn't replace surgery. To some degree, it's slightly different. Both surgery and energy-based, radio frequency-based tightening of the skin seek to rejuvenate the skin of the face and the neck. But with surgery, you're basically taking elements of the face apart, hitching them and removing excess tissue. But the skin remains the same. It's just better draped. With energy-based skin tightening, we have something called the face tight, the neck tight, for the face and the neck, AccuTight for the upper face and forehead, brow, eyelids, even body tight for the body. This uses the energy of radio frequency to tighten the tissues. It would be uncomfortable, therefore we use local anesthetic. Usually it's a one-off treatment, and I will often combine the face tight with the Morpheus 8. The face tight will tighten and attack the top of the skin and the undersurface, and the Morpheus 8 the middle of the skin. Who is it best for? For those patients who don't really want surgery, don't really want a cut, then this is one of the best treatments to give you that rejuvenation without having surgery itself. The face tight and Morpheus 8 procedures are not always a walk in the park, so we do have to have local anesthetic. But with evidence-based skincare, the face tight and the Morpheus 8, that's the most I can do for a patient in terms of facial rejuvenation without resorting to a cut and a scar. But we can discuss the pros and cons of that at the consultation. I will let you know what's right for you. The final thing is that the face tight and Morpheus 8 can be done as an outpatient under local anesthetic in the clinic.